Did you know that there are 5 rights to delegating tasks as a nurse to another profession? Hey guys, it's Tammy with NurseMinder, and today's video was inspired by a comment on one of the videos I had already created. Now, I tried to find who asked this question, but there's so many comments, I'd lost it in all of that. Nonetheless, today we're taking care of the 5 elements of delegating if you're working as a nurse. My name's Tammy, this is NurseMinder. Subscribe, hit that bell button so you get notified when the next video is released. Can you tell I'm out of practice? I haven't done a video for 3 months for this channel, and I'm so sorry, but I am back now, so we're going to get heavy into the content. So we're going to be talking about what delegation is, what that might look like for you, and some of the questions you need to ask yourself. So first, what is delegation? In essence, when nurses are delegating, what they're doing is they're assigning tasks and activities to another healthcare professional who's unregulated or unlicensed to do that job while still maintaining personally responsibility for the outcome of that task. Now, one thing we can never delegate is something that would require a nursing judgment. So for example, you've done a patient assessment and you're analyzing the data from the blood pressure, the low oxygen, from the high heart rate. You cannot delegate that nursing judgment to somebody else. Now, a quick disclaimer as we get into this video, I provide information that is educational in nature. You will need to check with your individual provincial or state boards or wherever you're watching me from. I do have international audience to understand what delegation is for you and your roles within it. So what's an example of something you cannot delegate? Well, that would be the assessment and evaluation of nursing interventions. So you need to give pain medication. You cannot ask an unregulated profession to go and do your pain assessment and then them report to you. You need to do your assessment. Similarly, you cannot ask them to go and evaluate a patient post-intervention. That's a nursing assessment and a nursing judgment. And so an example of something that you could delegate to another health care team member would be the mobilization of your patient, bathing, getting their food ready, those kind of things. Now, to help you know what you can delegate, there's a few questions you need to ask yourself first. Number 1, is this within their scope of practice to do? Do they have the skill set, the knowledge set, the equipment, and awareness of how that equipment works in order to carry out this task? Number 2 is the legal aspect. Is this legally something I can delegate? Now, there are just some things you cannot delegate. So there's kind of a 4 rule. Either you do it, you delegate it, delay it, or dump it. Do it means it is essential for you to do this. You cannot give this to anybody else. And an example would be the charting on your patient care. You can't assess a patient and then ask somebody else to do your charting. That would be something you have to do. It's expected of you to do. With the do it, delegate it, delay it, or dump it, we're not going to get into the last 2. We're focusing on the do it or the delegate it for this video. Now, it's important to remember, as the delegator who's asking the delegatee to do something, you as the delegator still maintain accountability for the completion of this task. The American Nursing Association has come up with 5 key components to delegating. So what are those 5 rights? The first thing is it the right task? Is the circumstance in which this task is being completed appropriate? For example, someone's crashing versus a patient who is recovering. The conditions are different. So it's the right task, the right circumstances in which this patient can safely carry out the task. Is it the right person that you're delegating this task to? Meaning, do they have the knowledge, skills, and scope to complete this task? Are you able to provide the right supervision? I don't know why I have a line here. The right supervision for, and then of course, right communication and direction around this task to make sure they can be successful in completing it for you. So let's look at this with an example. You're in the middle of a busy shift and you look down at your to-do list and you have medications to give, dressings to change, you need a patient that has to have his bath, you need to go and change the linens on a patient who's just vomited, and the list goes on. And you're thinking, I can't do it all. How am I going to delegate this and make sure all the patients receive the care that they need? So the first thing is to look at the right task. Which of these things can I delegate? And to help you with that, you're going to want to consider the legalities of the job, but also the scope of practice of the person you're delegating to, and the policies and procedures in your facility. So generally speaking, registered nurses are involved with assessment, planning, and evaluation of care. So those things cannot be delegated. So we have medication admin, we have wound dressings, we had a patient bath, and linen to be changed after a patient vomited. Linen to be changed sounds like something that doesn't require nursing assessment, planning, and evaluation. And the bath doesn't sound like that either, but the medication admin absolutely requires a nursing assessment, plan, and evaluation. And the wound dressing absolutely requires nursing assessment, planning, and intervention. So it sounds like we're down to 2 potential tasks. So then we get into delegation number 2, which is the right circumstances. So we're down to 2 tasks: bathing the patient and changing the linens on a patient who has vomited. Now, as a nurse, you want to make sure you have eyes on these patients to understand that first, that they're safe and that they are not high risk for decompensation, because if that's the case, it may not be the right circumstance to delegate these tasks. So let's just say you've gone in, you looked at your patient, the patient who needs the bath is now moaning in pain. We're not going to delegate this bath anymore because we need to assess what's going on and why they're in so much pain, and probably intervene with that first. The patient who vomited in the bed is sitting there laughing and apologizing for what they did, and they seem to be in no distress. This sounds like it might be an appropriate circumstance to delegate the task of the linen change. So to help you understand the right circumstances, there's a few questions you can ask yourself. Number 1, have I seen the patient? Do I understand the context of what they're going through right now? Number 2, is there appropriate equipment and training and skill set, knowledge set for the person I'm delegating to take over this task? And number 3, is the situation favorable for them to be successful? Again, if the patient who needed a bath is now in pain, we don't want them taking them to the shower while they're in pain. We want to manage that pain first. So a nurse needs to be aware of their patient status before delegating. So now we get down to step number 3, which is understanding who's the right person to delegate this task to. This is going to require that you have an awareness around their scope of practice and their experiential knowledge and skill set. So here's 4 questions you can ask the person you want to delegate to make sure it's the right person that you can use. Number 1, hey, I want you to do this linen change in the room. Have you done this before? So we want to assess if they have previous experience. Have you received the training to do this? So in terms of training, we're thinking of back safety. We may have to move the patient from bed to chair. So we're looking at patient handling and back safety. And then of course, the appropriate disposal of the soiled linens, those kind of things. So what training have they received around the task that you'd like them to do? Question 3, have you ever performed this task with a patient before? If it's their first time, you may need to provide more supervision than less. And if they've never done this before, they may require someone to go with them, a little bit more direction or supervision. And of course, the last question is, have you ever done this without supervision? This helps you to understand where your delegatee is in this process that you're asking them to help you with. And never assume that people know this. Let me tell you guys, I went through my entire 4 years of nursing and I never had a patient assigned to me who was a total care. And so when I got into my first job, I was like, I don't know how to dress this patient. I felt like I was incompetent. So never assume that the people you're working with have already done the task you're asking them to do. Okay, we're into the right supervision now. This is number 4. We've gone through the right task, the right circumstances, and the right person. So now we're into the right supervision. So if they require supervision, if they require feedback, you are that person. Now, the best thing here is to have that person follow up with you and let them know the job is complete so that you can go back in and just do a quick evaluation. And number 5 is the right direction and communication around the task. I can't stress this one enough. I think this should be number 1, but here we are at number 5. So with this one, we are not assuming anything. I think what those questions I provided you for step number 3 will help you determine what you need to do for this step. How much information do they need? Are they new to the floor? Have they been here before? Are they afloat or are they a permanent? Those kind of pieces of information, knowing that will help you ascertain if they need more support. Like, do you know where the patient lift is? Have you used it before? Have you used this one before? Instructions on what to do specifically. I would like for you to go in there. You need to change the patient linens. The patient's already clean, but if they're dirty, come back and report to me because I'll need to reassess them. Give them the container in which they can be successful. So applying the 5 steps of delegation helps you to ensure that your patient's care is optimal and safe. All right, let's do a quick summary of what delegation looks like for you. First of all, have you seen your patient? Because if you haven't, you're not delegating anything until you look at that patient. So has there been an assessment done by a registered nurse on this patient? Is the task that you want to delegate within the scope of practice for you to delegate? You got to know your own scope as well. Do you have the policies and procedures in place to delegate this task? Is the person you're delegating competent to do this task? And number 5 is the task in that recommended sphere that you can delegate it safely and they can complete it. So if there's no to any of those, you don't delegate, you do. Remember, the doing or delegate are the 2 things we're focusing on today. Is this a doing thing that I must do? It's my responsibility and it's essential that I do it because it's related to assessment, planning, evaluation. Or there's nobody competent to hand this off to with the skill set, knowledge, and experience, then you have to do it. If you answer yes to all those, then we get into those delegations of the 5 rights. So is it the right task, the right circumstances, delegating it to the right person, with the right supervision and direction and communication. So set yourself up for success. Know what's within your scope to delegate, what the organization is allowing you to delegate, and be sure you understand the people you're working with, and communicate, communicate, communicate. If you are ever unsure, just ask. It is safer to ask the question than it is to ask for forgiveness. Typically, I would say asking for forgiveness is a great rule of thumb, but in healthcare, we want to be asking for support first so that we're making sure our patients are safe. Don't forget to comment below. Let me know how this has helped you. Which right is the hardest one? I'd like to know which right is the hardest one for you to implement, where you feel like there's a bigger struggle or you kind of get stuck on this one. Let me know in the comments below. I do respond, as you know, because this video was inspired by one of my followers. Thanks again, guys, and make it a great day.